Anything else? And then now, do we have any membranes? Because this is the visceral layer of the serous pericardium. I wanted to leave the membrane on our heart, but it got cut off by accident, or on purpose, but oh well. Okay, so there's another layer out here. Okay, so we have it's like 2 layers, okay? Here's my glove here. The outer layer is the fibrous pericardium, and the inner layer that's fused to it is the parietal layer. So we have 2 layers, right? And they look like 1 layer. But if you stick a pin in from the outside, that's the fibrous pericardium. Stick a pin in from the inside, that's the parietal layer. But they're fused together, so it looks like it's 1 layer.
And then the visceral is what's on the heart, correct?
On the heart, the epicardium. And the lining of the heart is called the endocardium. And it also covers up the valves and also continues on to be the inner lining of the blood vessels. It's endothelial, simple squamous, okay? Have I left out anything? And this, of course, is the what? What layer is this called? Myocardium, okay?
Can you just go over every single one of these, like now?
I just
again?
did.
Well, I know, but reinforce.
Oh, okay. What is this?
Right atrium.
Right atrium.
Right ventricle.
Going out through the pulmonary trunk with the pulmonary semilunar valves, coming back through the pulmonary veins into the left atrium, going through the bicuspid or mitral or left AV into the left ventricle, going out through the aorta, past this valve, the aortic semilunar. Okay, and they're right near the arteries there, the coronary arteries, okay? And the fossa ovalis would be in the wall here, depression. And the ligamentum arteriosum would be here, okay? And the chordae tendinii are these, and the papillary muscles are these, and the trabecular cardi are these, but that's not on the list. I should put it on the list. So. That's everything.
Is the SA node visible at all?
No, not that I know of. It would be up in this area, right where the superior vena cava comes into the right atrium. And then we also have the left AV node here, also in the right atrium. So there's a lot happening in the right atrium. Lots happening.
Right atrium, it contracts first, or the electricity goes through first, and then it goes
Well,
to the left.
it's initiated in the SA node, but it's very fast. It spreads very quickly through both atria. But it can't go to the ventricles because of the fibrous skeleton that insulates them. But it spreads very fast because we have gap junctions, we have special conducting fibers. When it gets to the AV node, it's delayed for a little bit. So that most of the blood coming back to the heart just enters the ventricles by gravity. The atria push about 30% more in. But there's that little delay at the AV node. Then it goes down through the bundle of His, through the right and to left bundle branches, the Purkinje fibers. So basically, we have a contracted, simultaneous contraction of the atria, followed a little bit later by a simultaneous contraction of the ventricles.
So
Pretty simultaneous.
It tops off the blood, right? It tops off the blood, or that's totally different? When it contracts?
It puts about 30% more in. Most of it fills passively. 70% fills passively.
And then in that delay, the AV nodes close and the semi.
Nodes don't close.
That's good. Those are the blood. Okay.
Okay.
I'm trying to
Valves close. Valves close. Valves close. No, okay, so the SA node is up here, and that's the fastest part of the heart, called the pacemaker. If it gets destroyed, the heart slows down because then the atria are the next fastest part. If there's a blockage at the AV node, then the atria do their thing and the ventricles do their thing independently. Ventricles only do it about 40 beats a minute. So that's a problem. And if we can have flutter, which is very fast beating. If we have fibrillation, that's when it looks like a bag of worms. That's what he had in the video. Fibrillation's bad. You're going to die very fast from fibrillation. That's when they get out the paddles.
Stop your heart.
And they stop your heart, hoping that the SA node will take over again.
Martha, one of the questions in the lab was regarding volume differences in the 2 different ventricles.
The volume should be the same. Both sides have to pump the same volume.
Right.
Okay. Okay. And if they don't, blood's going to back up. That's what happens in heart failure.
Pulmonary.
So if the right side of the heart fails, blood's not going to get pumped out of the right side fast enough. Where's it going to back up?
Into the cava. The
And they come from where?
superior and inferior.
Where do they come from?
The lungs, or the trunk.
All over. So we call that peripheral edema. That's where you see the swollen ankles, swollen, things like that.
The right
But if the left side fails, where did that blood just come from?
The lungs.
The lungs. So if the left side fails, then you're going to get pulmonary
Pulmonary.
edema. That's what he was getting in the film.
Pulmonary?
Pulmonary edema. Fluid was going into the lungs. That's what my friend had just recently, pulmonary edema, because she had had a heart attack. She didn't know it. Okay. So what else do we have here?